Assalamu alaikum. Good evening, everyone. How are you all guys doing? I hope that you're doing great. You, your families, all the loved ones. How's life treating you? Welcome again to another session. I hope you're ready and excited to it. Musama Akbash, your host for today. And this is the English Club from Mr. Success Academy. We have started this long ago, and proudly, this is our 77th session. Let's get started. Let's get directly head to the first topic of today. The topic of today is what comes to mind when you hear the word doctor. In the past, when I was 7, 8 years old, the word doctor means injunctions. You're going to get an injunction, the pain. So I always used to feel afraid of doctors. I don't want to meet or see doctors at all. This word itself, is scary. And I feel that they only cause pain. But later on in the future, when I understood their job, they help us to relieve the pain, to reduce the suffering, the pain. I started to like some of them, and I feel good about doctors. All right. I know that because my elder sister is a doctor. From her, I saw how hard they work as doctors. They need to go through books, references. They study a lot. They work really hard to be called doctors. This is my view about doctors. What do you think, guys? Today I have you both are still here until the others will join soon, maybe yes, maybe no. But since you're here with me today, let's talk about this. Guys, who's ready to share his or her view? I have both Duke for Loves, I guess Mr. Ahmed, Roka Alice also is with us today. If you're ready, you can just put your hand up and I will pick you. For some people, they think doctors are the healer. Doctors are knowledgeable. They know a lot of things. They have skills. They are experts. They have the expertise in their profession. They diagnose the illnesses and diseases, and they decide the treatment. They give us medicine and care. All of this. And also, they give us hope. They hear us. They're kind to us. So, what do you think, guys? Are you ready to share your views? Don't hesitate. Take it easy. You are here to speak, to practice. Don't worry about the mistakes. Don't worry about picking the wrong words. That's not the point of this session. The point is just to help you say what you have. All right? Be it wrong, be it right, it doesn't really matter. It's not about this at all. It's about you trying to speak, because when you speak, practice doesn't make perfection. It makes progress. All right. When you practice, you make the improvement, and you are seeking for the improvement. You really need to improve. You don't need to be perfect. It's not about perfection at all. It's about progress, progression. Every day, when you speak a little bit, over time, you're going to get better and better and better. And that's the point. Welcome, Mr. Al Fatih, Muhammad Jafar. How are you guys doing? We are talking about the first topic is what comes to mind when you hear the word doctor. I'd like to hear from you guys. If you're ready, put your hand up and I will pick you. Feel free, take it easily, don't complicate it. A lot of people see doctors as highly educated people. And actually, they are considered as highly educated people because they study a lot. Let me hear from Mr. Al Fatih Muhammad. Go ahead.
Yes, Assalamu alaikum.
Wa alaikum assalam.
Good evening. Uh,
Good evening.
I'm very happy to be with you. Uh,
So do I.
you
Happy
hear
to have
me?
you. Yes, I can hear you now.
Yes, I'm happy to. Uh,
Mhm.
I hear.
You're breaking a little
Yeah,
bit.
yes,
If it's
I hear.
possible, yeah. Mhm.
I very soon.
Mr. Fatih, your voice is not clear at all. Maybe the network is poor where you are. If you can reposition yourself, it's going to be better. Change the place that you're in and sit in a different place and try again.
Okay, thank
All right? Yes, no
you. Okay,
worries.
okay,
Since then, yeah, please choose a different location, log out and log in again. You might be audible to us.
okay. Thank you.
Okay. Okay. Yes. Since then, I'm going to pick a different speaker to speak. What about you, the others, guys? Muhammad, Jafar, Ruka, Alas, Duke for laughs. If you are ready, put your hands up and share your views easily. Are you good now, Mr. Al-Fadi?
Okay, I will try.
Okay, now good. Yes, I can hear you clearly. Yes, go ahead.
Oh, okay. About topic today. Yeah.
Yeah. What comes to mind when you hear the word doctor?
Yes. When I hear the word doctor, I think of person that who are sick people. You hear me well?
Yes, I can hear you well. Continue.
Okay. Okay. And I think doctors work hard to keep people sick and save lives. And they have a lot of knowledge actually about diseases and medicines. And they are very important. The doctors are very important members of society, as you know, because they help people feel better and live healthier. Uh, this is all. Thank you very much.
Thank you, Mr. Al-Fadi. That was
Thank
very
you.
powerful for sharing. Thank you. All right. What about you, the others? Roca Alice, go ahead. I don't know if I pronounced the name correctly. Your hand is up now. You can unmute yourself. Is it Ruqayya?
Okay, good
Ruqayya,
morning,
right?
good evening.
Hello. Wa alaikum
Uh,
assalam.
Good evening.
Good evening.
Okay, I'm Ruqayya Ibrahim.
Mhm,
So, my point of view comes from the thing that I saw. It's not definitely the thing that I can say it defines the doctor themselves. But the first thing that comes to my mind from the time before I enter university is the situation with the doctor who had no good manners in dealing with the patient.
mhm,
So that was the thing that made me hate even the word doctors when someone says to me,
mhm,
because I'm in the medical field also.
mhm,
So that the first thing that comes to my mind is the lack of the aesthetics in the job. and not training patient with the kindness. Honestly, these are not the aesthetic that should belong to someone who profession the prophet described as one of the noblest profession. Uh, Despite that, when I got involved in the medical field, I realized how much the exhaustion they go through during their study period and work. I testified their competence in that so really I respect doctor who commit to good aesthetic despite the pressure. It is a noble profession, not a reason for showing off, and that really what people do now. They not care about the patient and what they need to do. They just care about, oh, I'm a doctor, look at me. So that is all. Thank you for listening.
All right, wonderful, Ruqayya. Thank you for sharing. What you said
Okay.
is absolutely correct. Of course, we cannot judge all people, all doctors, especially thinking that they are only bad. No, no, not all of them. Majority of them are good. They have worked, studied hard, but some, a very few of these doctors, they are for showing off. I'm a doctor. Don't just say my name without a doctor. If you call them
Uh,
by their real name, Muhammad, no, 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 I'm not Muhammad. I'm Doctor Muhammad. That's really bad.
okay, but those who said there are few, they make a bad reputation about the doctors. So to handle this, we need to work hard, and even the doctor, you need to change these beliefs.
Yeah, true.
Inshallah.
Okay. Inshallah, hopefully. And also, I see this in many different other professions. For example, the engineers, they also see themselves are the best of the best. I'm an engineer, I'm so and so. You cannot call me so and so directly. Say engineer so and so. They just feel exactly like the doctors. Their IQ is higher than everyone else. And that's not true at all. Let's hear a different view, Mr. Muhammad Ja'far. Go ahead. Muhammad Ja'far, right?
Hello guys,
Hello.
yeah, yeah,
Hmm. Go ahead.
good evening.
Good evening.
Actually, when I hear the word doctor, could be three meanings. Uh, for example, the first one uh, comes from my mind is academic title. The doctor who teach us or give us information in the university. It could be a doctor in the medical field. The people who treat us or uh, cure us in the hospital. And also could be a vet. Like it could be mean that uh, the people who I forget, but I guess that it means someone who treat others, or I forget. Sorry for that. Thank you.
It's okay. Carry on, carry on. Thank you, Mr. Muhammad Ja'far, for sharing your views. Let me go to the last, Ahmed Adam. If you're here with us, you can also go ahead, sharing your views.
Oh,
Hello, Ahmed. How are you?
I'm good, and you?
I'm really great. Good to see you here today.
Alhamdulillah.
That's amazing. Let's go ahead. Share with us your views about The question, what comes to mind when you hear the word doctor?
Okay. When people hear the word doctor, they usually think of heavy with coat and hospital. The word aspect of this job are long shifts, stress, and consistent and wide healing and word sections healing and out out outside or carry. Thank you.
Thank you, Mr. Ahmed, for sharing your views. Let's go, guys, to the next. The next section is the reading section. Is to test you, test your skills reading, your reading skills. Doctors. This is the title. When most people hear the word doctor, they immediately think of someone who helps sick people get better. A doctor is often seen as a symbol of care, knowledge, and trust. Some imagine a person in a white coat with a stethoscope, ready to listen to a heartbeat or give advice about staying healthy. Others may picture long hours of study, hospitals full of patients, or even the stress of emergencies. But being a doctor is more than just treating illness. Doctors also guide people toward healthier lifestyles, prevent diseases, and bring comfort during difficult times. For many, the word doctor represents hope, the idea that someone is there to help when life feels uncertain. All right, who's ready to go? Who's ready to start the reading session, guys? Let's go. Put your hands up and I will pick you. It could be a little bit challenging, but that's what exactly you need to progress. In order to grow, you need to go through some difficulties. Let's go, Mr. Fatih, Mr. Muhammad, Mr. Ahmed. Take a go.
Yes,
Yeah, Mr. Fatih, go ahead.
yes, okay. When most people hear the word doctor, they immediately think of someone who helps sick people get better. A doctor is often seen as a symbol of trust. Some imagine a person in a white coat with is, uh, is, uh, with a scope ready to a heal patient or give advice about staying healthy. Others may uh, picture long hours of study. Hospitals more than just sorry, hospitals full of patients, or even the stress of emergencies. But being doctors more than just treating uh, illness. Doctors also guide people toward healthier lifestyles, prevent diseases, and bring comfort during difficult times. For many, the word doctor uh, dispenses hope. The ideas that someone is there to help when life gives infection, uncertain,
Uncertain. Uh,
uncertain.
yes. Thank you. Thank you,
Okay.
Mr. Fadir. Well done. All right. What about you, the others? Guys, are you ready to go? Mr. Muhammad, Mr. Ahmed, just put your hands up and I will pick you. As we all know, reading is one of the skills of the language itself. We have the four skills, the listening one, in order to help us to speak well, we need to listen a lot and to speak also. And to improve the writing skills, you need to read a lot. When you read a lot, things are going to be very familiar to you, and you won't face any difficulties, all right, with writing unless you read too much. If you don't read, you always find yourself struggling with writing even few sentences. Mr. Ahmed, go ahead.
Okay. When most people hear the word doctor, they uh, immediately think of someone how health sick people get a doctor is seen as simple or non non and in in pain in pain person in in a way cover uh
Mr. Ahmed, you're breaking. The voice is not clear. All right. Since you get ready, Mr. Ahmed, we will come back to you again. Mr. Muhammad, go ahead. Ahmed Jafar, go ahead.
Uh, when most people hear the word doctor, they immediately think of someone who helps sick.
as is
They immediately think of someone who helps sick people get better. A doctor is often seen as a symbol of care, knowledge, and trust. Some image a person in a white coat with a stethoscope, ready to listen to a heartbeat or giving advice about staying healthy. Others may picture long hours of study, hospitals full of patients, or even the street of emergency. But being a doctor is more than just treating illness. Doctors also guide people towards healthier lifestyle, prevent disease, and bring comfort during difficult times. For many, the word doctor responds hope. the idea that someone is there to help when life feels un, un, uncertain.
Perfect. Thank you, Mr. Muhammad. Okay, there are few words, but it's okay. We highlight them. Maybe people will find difficulty with them, but it's okay. The first one here is stethoscope. Then we've got represents, uncertain, uncertain here. Then let me pick Miss Roqaya. If you are ready, you can go ahead. This is a reading session. Read this short text. If you cannot hear me, Miss Roqaya, let me go to Miss Khairat. All right, Miss Khairat, go ahead.
Hello, Mister. How are you?
Hello. I'm really good, and you?
Well, Alhamdulillah.
Perfect. Good to have you here. Let's go.
Okay. Doctors. When most people hear the word doctor, they immediately think of someone who help sick people get better. A doctor is often seen as as symbol of car knowledge and trust. Some imagine a person in a white coat with a stethoscope ready to listen to her heartbeat or give uh, advance yeah about staying healthy. Healthy. Others may factor long hour of study, hospitals, field of patients, or even the stress of emergence. But begin a doctor is more than just treating illness. Doctors also guide people uh, to, to, toward health lifestyles, prevent disease, and bring comfort during difficult uh, times. For money, their word. Doctor represents hope, the idea that someone is there to help when life flows ill, certain, uncertain.
Uncertain, yeah,
Yeah,
uncertain. Thank
uncertain.
you,
Yes,
Ms. Khairat.
you're
You did your
welcome.
best. That's awesome. The word here is that stethoscope is the tool that the doctors they use to hear the heartbeat. It's called stethoscope. All right, Mr. Ahmed, yeah, if you are available here now, you can go ahead before I move to Ms. Roya. Yeah, continue,
Yeah,
Mr. Ahmed.
okay. Uh, I'm sorry, my network not help to me to press
It's
stop.
okay. It's okay.
Okay, now,
Yeah, keep going.
okay. When most people hear the word hello,
Yep, we can hear you. You can just carry on.
Allah,
Read. Yeah. Mhm.
الصورة اختفى مني.
It's okay. I'm going to send it to the WhatsApp group, all right?
Okay,
Check it out from the WhatsApp group right away. No worries. Since you get the picture, let me ask Miss Ruaya to read, and then I will come back to you again, okay?
okay, no problem.
Yes. No. Okay, good. Miss Ruaya, go ahead. And Mr. Ahmed, get the picture from the WhatsApp group. Since that, you
O-
get ready.
Okay, doctors. When most people hear the word doctors, they immediately think of the someone who helps sick people get better. A doctor is often seen as the symbol of care, knowledge, and trust. Some imagine a person in white coat with a set stethoscope, ready to listen to the uh, heartbeat or give advice about staying healthy. Others may picture long hours of study, hospitals full of patients, or even the stress of emergency. But being a doctor is more than just treating illness. Doctors also guide people toward healthier lifestyle, prevent disease, and bring comfort during difficult times. For many, the word doctors represent hope, the idea that someone is there to help when life feels uncertain.
Big thank you, Miss Ruaya.
Okay.
Mr. Ahmed, see, now you can go ahead. The picture is on the WhatsApp group. Open the picture from the WhatsApp group and read. Don't rely on the picture that you see here. You're the
Okay,
last.
uh, when most people hear the word doctor, they immediately think of someone how people sick, how health sick people get better. A doctor is often seen as a symbol of care, knowledge, and trust. Some, some in am- amazing, some amazing person and simple what was this, this uh, this ready to listen to a helpet or give advice advice about staying healthy. After my picture, long hours of study, hospital full of fitness or, or even just stress or emer- emergency. But being a doctor is more than just train at least illness. Doctor also guide people to art health, uh, li- lifestyles, lifestyle prevent disease and drink, drink drink comfort, comfort during difficult, difficult times for money. The word doctor res- uh, represent represent head represent of the idea that someone is there the help when life feels uns- un-
Certain.
uncertain.
Yes, that's thank you, Mr. Ahmed. After you struggling, you did not give up. You chose to read. That's it, life. That's it, guys. Life is about choices. When you decide that you're not going to give up, you're going to get what you want. Thank you, Mr. Ahmed. Let me move ahead to Mr. Ayman. You are the last.
Yeah. Hello, Mr. Osama.
Hello. Hello, Mr. Ayman. How are you?
How are you doing?
I'm really doing good. And you?
Ah, fine. Thank you for asking. Hi,
Great.
guys. Good evening. Sorry to be late, Sister Seth.
All right. No
Actually,
worries.
I have uh, I was busy.
All right. No
Uh,
worries.
right now, I want to share you reading,
All
like
right. Great.
reading.
Since you're here, that's
So
great. Carry on.
yeah, thank you. Uh, doctors, when most people hear the word doctor, they immediately think of someone who helps sick people get better. A doctor is often seen as a symbol of care, knowledge, and trust. Some imagine a person in a white, sorry, uh, 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 some imagine a person in a white coat with stethoscope. Is that right?
Stethoscope.
Stethoscope.
Stethoscope. Yeah.
Yeah,
Cop.
stethoscope.
Cop, not E. You don't need
Uh,
to pronounce the E at the end
stethoscope.
of words. Yeah.
Stethoscope. Stethoscope.
Yes. Yes, that's
Yeah,
correct.
thank you. Thank you. Some imagine a person in a white coat with stethoscope ready to listen to her date or give advice about staying healthy. Others may picture long hours of study, hospitals full of patients, or even the stress of emergencies. But being a doctor is more than just treating illness. Doctor also guide people toward healthier lifestyles, prevent disease, and bring comfort, comfort during difficult times. For many, the word doctors response represents represents hope. The idea that someone is there to help when life feels uncreated. Is that
Uncertain.
right?
And
Uncertain.
uncertain. Yes. Thank you.
Uncertain.
Yeah.
Yeah,
Thank you,
thank
Mr.
you.
Ayman.
Thank you.
Well done. All right. Let me highlight a few of the mistakes here regarding pronunciation. This will help you get better, guys.
Okay.
Firstly, we've got the word, this one here, as you see, Some people they say her. You don't say her for this one. You have ea double vowels here. You pronounce it the first one, the first vowel that you see here. You just say the name of the letter here. The name of the first letter, the first vowel here, it's e, but the sound is e, as in the word bed. But here there is another vowel with it. So you're going to pronounce it as E. You're going to say here. And this one, this word, you say her, her, her car, her husband, her children. And for this one, you say hair, hair, like mine. I have shaved recently, and that's why I don't have any hair. But here, notice, guys, you need to pay attention. The first one, you say her, her, not hair. It's not the correct pronunciation. Her. The second one, you say hair, a. Notice the first vowel is a. The name is a. That's why you say hair. And the last one here that we have in the text is hear. When most people hear, when this verb in the past is going to be heard. I heard people. When most people heard, this is the past, but the present you say hear. All right. Then also here we've got this one, stethoscope. Stethoscope for this one. All right. Then we have here, you need to pay attention to the S, guys, at the end of words. The S is not pronounced the same. Sometimes is and S. Here, you notice with words that they end in voiceless letters, like patient, we say patience. But when the word end in a voiced letter, is going to be z, like this. As you have here, times. We don't say difficult times. No, difficult times, like this. And is like in the word disease. Notice here, this one end in a letter that has a hussing sound. Hussing sound like s. When the word ends in a sound like this, and you add S to it, you're going to pronounce the S as is. Here, you say diseases, not disease. Disease if there is no S at the end. But there is an S here. So you're going to say diseases. All right? And the last word here, guys, is uncertain. The C, whenever that there are C, I, C, E, C, Y, the C is always going to be pronounced like the letter S. Notice here in this word uncertain, you have CE. That's why you didn't say uncurtain. No, there is an E here. CI, like in the word city, CITY, you say city, CI. Uncertain, or the word cell, CELL. You don't say kel, you say cell. And the last one you have CY is going also to be like the word cycle, CYCLE, sigh, but the other C is going to be K because there is an L after the C. I hope you guys pay attention to this. Just I call them highlights. Along the sessions, we're going to master all of them. Thank you guys for listening, and thank you for reading. You did your best. Keep on going, but please make sure that you correct the mistakes. Don't carry on having the same mistakes to feel that you are progressing. Then let's move on to the tongue twister. It's a bit easier today. I slit the sheet I slit, and on the slitted sheet I sit. It's very easy. All right, Mr. Ayman, go ahead. I saw you raised your hand. Do you have a question or would you like to read the tongue twister? Maybe Mr. Ayman is not ready. Who else is ready to take on this tongue twister? It's very easy today, like you. I slit the sheet I slit, and on the slitted sheet I sit. All right, Mr. Ayman, go ahead.
Yeah.
Mhm.
I slid the sheet. The sheet I slid on the slated sheet. I sit. I
Yeah,
slid the sheet. The sheet I slid on the and on the slated sheet. I sit.
perfect. It's
Perfect.
very easy today, isn't it? Yeah, that's
Yeah,
correct.
yeah.
All right, awesome. All right, what about you, the others? Who wants to give it a try? Mr. Fatih, Mr. Rugaya, Mr. Ahmed, Ms. Khairat. Let's go, guys. Today you've got the easiest tongue twister ever. Ms. Khairat, go ahead.
Okay, hello again.
Hello, go ahead.
Okay, I slid the sheet. The sheet I slid, and on the slit sheet I sit. I slid the sheet. The sheet I slid. The sheet I sit, and on the sheet I sit.
Perfect. Thank you, Ms. Khairat. Ms. Rugaya,
You're
go ahead.
welcome.
Perfect. Well done. Ms. Rugaya, are you with us? You're here. Go
Okay,
ahead.
okay. I slit the sheet I slit, and on the slitted sheet I sit.
Perfect.
Okay, thank you.
All right, Mr. Fatih.
Okay. I see the sheets, the sheets I slit, and on the slitted sheet I sit. I slit the sheet I slit, and on the slitted sheet I sit.
Perfect, Mr. Fatih. Mr.
Thank
Ahmed.
you.
Some people they think sheet only. This word only means the sheet of university of the materials of the courses that you have. That's not correct. Sheet doesn't mean the classes, the lectures, the lessons. No. Sheet could be the piece of cloth that you use to cover your body. It's called sheet. All right, Mr. Ahmed, go ahead.
Okay, I slit the sheet I slit, and on the slit sheet I slit a sit.
Well done. Thank you, everyone. All right, people. Now let's go ahead to the main topic of today. Of course, all of us, if you're not yourself in the medical field, all right, you are maybe still studying, maybe you're graduated long ago, or maybe you're not in the medical field, but of course, you might have some of your siblings, cousins, friends, neighbors, whatever, a person you know who's in the medical field. What do you think are the worst aspects of being a doctor? Do you think there are any aspects of bad aspects of being a doctor? I think that people think that you are rich, you have a lot of money, you give things for free, you have a lot of giveaway, you work too hard, your job is very stressful, you don't have time for your family, your loved ones, you're always busy, rotation after another, always surrounded by blood, patients, troubles, illness, diseases, medications, and so on. What's your view, guys? What do you think of this question? If you know, of course, you do know some people that are around you that they work in the medical field, be it a doctor, a nurse, a pharmacist, a laboratory scientist, whatever. What do you think? I'd like to hear from you. Maybe they could, as you see, the reason here is that they work long hours, they have sleep uh, deprivation, they have high stress and mental pressure. Okay, of course, also lack of work-life balance. They also suffer from this. They need to pay a lot of money to continue their studies, especially if they would like to be specialized in a specific uh, field. What do you think, guys? I'd like to hear from you. You don't need to think too much. Just take it as simple as you can. Who wants to start? Who's ready to share? All right, Mr. Al-Fatih, go ahead. Can you hear me?
Sorry.
Yeah, it's okay. Go ahead.
Sorry. I think one of the worst aspects of being a doctor that they work in long hours a day. Besides facing a lot of pressure, as you know, because they are responsible for people's lives and health, and this is a very big responsible. And if I want to give an example, in our family, my son is a doctor, and uh, he worked very hard, and he is no holidays, always work in his lab or in hospital. Then many of our organizations, family, he can't share us, and this uh, some people blames blame him, but he was no way. I think this is a very one of a very big one of big problem to be a doctor, that you have no time to share your family, your um, uh, maybe your son in very important occasion. Beside others, as you know, and this is enough for me, and take a chance to others. Thank you.
Thank you, Mr. Fatih. He just reminded us of the being a doctor is a noble calling, but it comes with heavy burdens. Let me hear from Ms. Khairat. Share with us your views.
Okay. What do you think are the worst uh, aspect aspects of being a doctor? Okay, I think firstly, uh, work for long time. Some doctor uh, all the time work, hospital and general hospital and special cleaning. Uh, and also, I think unbalance for work and time with the family. This also a big problem. And some doctor and also some nurse uh, found or work all the day, and the last day go to the house, feel a bit tired, and also tomorrow found um work, uh, go to sleep early, not any new with any new in the home. Yes, I think that is a big problem. Um, so um, I see, I'm see any doctor or any sister uh, necessary balance. Yeah, that is all for now. Thank you for listening.
All right. Thank you, Khairat, for sharing your views.
You're
Let me
welcome.
go to Rogaya. Rogaya, go ahead, Miss Rogaya.
Okay, so as me as Ruqayya, the worst aspect of being a doctor is there is no time for the family, for the friend, for the sociable meeting. And me as a sociable person, I cannot handle that, and the pressure that I will be under. Yeah, the worst thing is to be away from your family, from your friends, from the meeting that they handle, and enjoying it by the life. Yeah, that is all.
All right, thank you. As some doctors, I have friends, a lot of friends. My sisters are doctors. I have two sisters, the eldest and the youngest, both of them are doctors. I have my cousins, three of them are doctors. I have a lot of friends that they are doctors. They say that this profession is a noble profession, but unfortunately, you don't have a personal life. You find yourself very worse in terms of keeping in touch with the family, attending the family occasions. As Mr. Fatih was mentioning, his son is always busy. He doesn't have time to join the family occasions, the family gathering. They're always busy. Let me go to Mr. Ayman. Go ahead.
Yeah, welcome again, Mr. Sama.
Yep, go ahead.
Yeah,
What
when
do
I
you?
heard doctor's word, uh, the first thing present in my mind, uh, those people had hard work and long years of study. Uh, Also, I believe the doctors should be uh, responsible, responsible and helpful and suffice people life. This important which any doctors work in field study, in medical study. Sorry. Uh, Really, the doctors maybe they have worries that time or life or life because according to his the job of doctors need on call 24/7 uh, on long shift also. All this make the life of doctors poor because they have lack time of gathering family events like holidays, and wedding, and so on. This make doctors uh, maybe could not cover every event. But the importance is absolutely the mistake, medical mistake. This really is a crisis of people because when the mistake of everything, everyone, is not problem, not dangerous for our life. But when mistake carried by doctors, maybe this uh, make a big problem of life. People, they could not respect the mistake of doctors. This maybe the doctor need for granting of mistake because everyone in our life we have error, personal error. So people they could not respect or imagine this doctor person like us. So they could not respect every any mistake. These are the worst things of medical work, especially in Sudan. Need to government law to make organization of medical work for to give guarantee for patients or and also guarantee for doctors. Sometimes these mistakes came by the uh, personal irresponsible. So they don't took care full care from the patient, but sometimes came by out factors. The doctor have no anything to do. So we need the law organizes and I dedicate what who is responsible for this mistake. And really, I have full respect for doctor for everything they do to save our life. Thank you for your listening.
Thank you, Mr. Ayman. Mr. Ayman mentioned here a very crucial part is that we need a law or an organization, at least an association, a union to guarantee the patient's right and the doctor's right as well. We have seen this happen a lot in different clinics, hospitals, that the co-patients, they attack the doctors. They try to hit the doctors because of the patient passed away. They brought the patient who's already struggling, is dying. When this patient passes away, they come to hit and fight with the doctor, the nurse. All of these, they become victims of the co-patients. And sometimes the patients, they passed away because of mistakes, irresponsible behaviors from doctors. That's why they passed away. So we need an organization, we need a law at least to guarantee, as Mr. Amin said, for both parties, for the doctors to protect the doctors from the co-patients especially. Are the most dangerous people are the co-patients that they come with the patient. And also, we had a lot of funny events around this, okay? And for the patients to guarantee their right.
Excuse me, Mr. Osama.
Yep, go ahead.
So very important things the government law. As I know, where I live here in Saudi, the rights of patient or doctors apply on internet. When you go to the hospital, especially like emergency, sometimes an accident happen. People they don't know what going on in the coming time. So you have right the nearest hospital, clinic, every type of medicine agency, they do help for you without anything. Don't ask you about money. sometimes we have emergency like our women's like our wife, ladies, and so on. Pregnant, we need to help from doctor. If we know how we have no law, the doctor say you should pay first before I do anything. I mean that save people very important. The first thing. After that, you can ask about your uh, rights. Also, the condition of hospital. This is very important. Some hospital or clinic, uh, it is not allowed to make uh, you sometimes you have broken ladies and so on. There are special way places. Not every place you can say this عملية يعني. This
Operation.
very important operation. Very
Yeah,
important
operation.
thank you. This is very important for the law to save the doctor firstly before everything. Not mean I doctor I do everything in anywhere. No, there are special site or special places I could make operation and so on. I mean that. So the law government very important to organize the medical field. Thank you.
Thank you, Mr. Ayman, for sharing this. And we need, guys, as human being, as citizen, we need to make sure that this reach out to the government. They need to be aware. Sometimes they don't know, or maybe they don't give the enough importance for the thing here. For example, I have noticed this a lot in a lot of hospitals, especially the emergency department. When someone is being brought there from an accident, an issue happen, they ask you before they provide all the medical services for this person. If this person is bleeding and dying, they need to ask you to bring a police report. Guys, this guy is dying, is bleeding. Please take care of him first. They say no. You need to go to the nearest police station and bring a police report. Why for? It's a humanitarian job, right? At the first place. You need to rescue the lives of people. Then you go to the procedures. But they don't do this. They go through the procedures first. And if this person is bleeding, they are willing to wait until that person dies in front of the hospital with the heart as cold as a refrigerator. They don't do anything. Let me hear from Mr. Ahmed. Mr. Ahmed, go ahead. What do you think is the worst?
Hello again.
Hello?
Uh, what do you think are the worst aspects of being a doctor? Okay. Uh, the worst part of being a doctor are a long work hours, have mental stress, and a have rest uh, of of uh, of brown. This challenge impact impact personal life, mental health, and daily energy. Okay, thank you.
Thank you, Mr. Ahmed. All right. Anyone would like to add anything to this topic? Would you like to give any advice, comment, anything? All right, Miss Khairat, go ahead.
Okay, I'd like talking around one topic. What comes, what comes to mind when you hear the word doctor? Okay, uh, the first help people and take medicine before after say diagnosis and test, yeah, and also saves lives and also maintain and responsibility to life of patients. Uh, the doctor found a hospital and also found emergency laboratory. Also, doctor have stethoscope, uh, take diagnosis, yeah, uh, and patient history. Also, assessment to patients. After that, give the patient medicine and treatment and constant also advantage. For example, patient uh, disease, blood pressure, for example, or diabetes. Uh, this person or these patients needed before treatment need uh, guidance and advance. Take care for yourself and take care for your life. Uh, prepare sugar and pasta. Take or make vegetables, some vegetables and fruit. Yeah, food healthy for that. Around rule doctor is very important for your life after Allah subhanahu wa ta'ala. Yeah, I think that. Thank you for listening.
Thank you, Miss
Listen.
Khairat. That's great.
You're welcome.
That's well done. Thank you for sharing this. All right,
You're
people, all of
welcome.
us, we need to have the education of being aware of the health part, the medical part of our lives. We need to be healthy. We need to keep in good touch with the doctors. We need to know our rights. All right, as well as we know their rights. They know we need to know ours as well. All right, and also sometimes we need
Okay.
to give up complaints to the hospitals, to the management, to solve the issues. Sometimes the management themselves, they're not aware of the mistakes that the staff commit. The staff, they could be the doctors, the nurses, the guard, the pharmacist, the laboratory scientist. Everyone in the
Yeah.
hospital is considered one of the staff. We need to reach out to the management to give complaints, and this will
Exactly.
help.
Sure.
It will help to reduce the problems, reduce the
Sure.
mistakes that they commit, because no, none of them is is ready to risk the career to be fired. They are here to make a living. So that's why they're going to be very sure to follow the rules, the guidelines of the hospitals, to obey all of them, and to stay committed. All right, that's it, guys, for sharing your views. Since we have taken a lot of time talking about this, the last part of the session, of course, is the quote. And if you would like to add anything or say anything to your other classmates, you can go ahead before we close the day, because I know all of us have been busy with life obligations, so on and so forth. So if you would like to add anything, go ahead. You have few minutes. Take it as your opportunity to speak. Okay, let me close the day with the quote is the future belongs to those who believe in the beauty of their dreams. All of us have dreams, guys. Sometimes there are wishes when you are not willing to work for them, they are just wishes. But these dreams that you have, maybe since you were a child, when you were 5 years old, 7 years old, 10 years old, maybe you had dreams, things you would like to own, places you would like to go to, people you would like to meet. Believe in these dreams and start working to achieve the dreams. This Eleanor Roosevelt said this. And that's it for today. It has been a very nice session having you guys. Thank you for the commitment. You keep coming here every Saturday, and you keep sharing on the groups every Tuesday and many other different days. That's awesome. Keep on doing this and always believe in yourself. Never give up. Keep going on, and you will get exactly what you want and more. Thank you, everyone, for being here today. Stay happy and have a great night. Goodbye.